Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for Wednesday, November the 25th. We're honored to be here on the territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. Tomorrow, Thursday, at 3 o'clock, we'll be giving a written briefing with COVID-19 case numbers and other relevant information about the pandemic in British Columbia. And on Friday, from here, from Victoria, we'll be giving an in-person briefing, Dr. Henry and I, at 3 o'clock. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much, and good afternoon. For today, for our COVID update, we have 738 new cases of COVID-19 to announce, 4 of which are epidemiologically linked, bringing our total number of cases in British Columbia to 29,086 people. That includes 169 people in the Vancouver Coastal Health Region, 443 people in the Fraser Health Region, 21 people on the Vancouver Island Health Region, 70 people in the Interior Health Region, and 35 people in the Northern Health Region. That leaves us with 7,616 active cases, of whom 294 people are in hospital currently, 61 of whom are in critical care or ICU. Sadly, in the last day, we have an additional 13 people who have died from COVID-19 here in British Columbia, bringing our total number of people who have died to 371. And we always express and feel deeply when we have people, particularly our elders, who pass away from COVID-19, and our condolences go out to the families, the care providers, and our whole community who mourn the loss of 13 more people in British Columbia. We have 10,270 people who are under active public health monitoring and 19,814 who have now fully recovered. I do want to report, however, that we've had some challenges with one of our data systems. So I will be reporting right now a data correction in the daily case numbers that affected particularly the Fraser Health Region. There was a technical error in the transfer of data from a lab to the health authority, which meant there were errors in reporting new cases between the 17th and the 24th of November. So the numbers that I just presented today are the end result, but the daily numbers between the 16th and yesterday have changed. The data has been reviewed in detail over the last 24 hours and is authenticated. And this will be updated on the BC CDC dashboard in the coming 24 to 48 hours. And I bring attention to this because I know some people use those daily case counts and the 7-day rolling averages to help understand the trajectory and what is happening, particularly in each health authority. So I will tell you what the numbers were, and we will be posting these, and you'll be able to update them on the dashboard within the next day or two. So on the 16th of November, and we reported 324 cases from Fraser. Sorry, we reported 461 cases, and the actual number was 324. On the 17th, we reported 484 cases. The actual number was 343. On the 18th, we reported 481 cases. The actual number was 537. On the 19th, we reported 308 cases, and the actual number was 417. On the 20th, we reported 294 cases in Fraser Health. The actual number was 610. On the 21st, we reported 488 cases. The actual number was 634. And I will note for those 2 days, our our new total for the province rose from what we reported as 516 to 832. And on the 21st, our reported 713 cases, that was actually 859 on that day. On the 22nd, we reported 469 cases in Fraser Health, and the actual number was 525, bringing our total that day to 682 in the province. On the 23rd, we reported 347 cases, and the actual number was 432, which would have brought our total to 679 cases. And yesterday, the 24th, we reported 678 cases, and the actual number from Fraser Health was 443, bringing the total in the province yesterday to 706 cases. So I know we had a dramatic increase in the daily numbers. That was a result of some of these data coming in at a different time. So we apologize, of course, for the challenges. It's always complex when we have many data systems trying to feed into a single report on a daily basis. But as I say, these numbers will be available, and we will make sure that the BC CDC dashboard is updated appropriately. In terms of outbreaks, we have no new healthcare outbreaks today, and the one outbreak at the Royal Columbian Hospital has been declared over. That leaves us with 57 active outbreaks in the healthcare system, 52 in long-term care or assisted living, and 5 in acute care, with 1,036 cases active, including 634 residents and 385 staff. As well, there's been an outbreak. The outbreak at MSJ Distribution has been declared over. This virus, as we all know, is putting a strain on all of us, which is why now more than ever, we need to think about compassion and care for ourselves, for our families, and for others. Today, the BC Coroner's Service released their monthly report on illicit drug overdose deaths. And once again, that number has become unacceptably high, with 162 people in British Columbia dying in the month of October. As we have seen, COVID-19 continues to dramatically amplify those consequences that we know are a part of the overdose crises that we have been experiencing here in British Columbia. Particularly, we know the effects of the extreme toxicity of the drug supply, and that is reflected in the high levels of concentrated fentanyl and other analogs that have been found in those people who've died in this past month. I appeal to anybody who uses drugs to ensure you use with your own personal safety at heart. Don't use alone. Let somebody know. Talk to somebody. Use the app. Have your drugs checked. Reach out. As you know, in September, I expanded the healthcare professionals who are able to provide you with a safe supply of pharmaceutical alternatives to what we know are deadly drugs on the street right now. It is also a place that you can go for help. If you are looking for help, reach out. If you know somebody who's using drugs, now more than ever, as we're moving into this critical phase of our second wave, we need to care for each other. We need to reach out. Reach out to your family, your healthcare provider, or you can call, go to stopoverdosebc.ca. There are resources there to help. Today also marks the first of 16 days to end gender-based violence. And with the necessary restrictions in place, getting support and getting away from a violent situation right now during this pandemic, we know is an additional challenge. If you or someone you know is experiencing violence, there is help as well. Contact Victimlink, a toll-free, confidential, multilingual service 24/7 you can call or text 1-800-563-0808 or email victimlinkbc@bc211.ca. This is a time where we need to reach out, we need to connect, and we need to support each other. Yesterday, the Minister of Public Safety and the Solicitor General issued a new order with enforcement measures for the use of masks in all indoor public spaces. This public safety order focuses on those locations where it's not always possible to maintain that safe distance and where wearing a mask is important for your protection and the protection of the people in that environment. It is one of those layers that has become incredibly important as we're seeing this surge in our community here in BC. And a comprehensive list of the locations where the order applies, as well as people who are exempt, is available on our website, and there's a link to it. But I'd like to remind everyone that, as I have said many times, masks are required in many locations, and they are one of the important measures that we take. But not everyone is able to wear a mask, and we need to have patience and compassion for people. Nor does this apply to children under the age of 12. So we do not recommend masks at all for children under the age of 2, or for anybody who can't remove a mask on their own. We encourage it in children between the ages of 2 and 12, but it is not mandatory. And we know that people can't wear masks for many reasons that may not be apparent to you, whether it's a psychological, behavioral, or health condition, or due to physical, cognitive, or mental impairment. So if you see somebody without a mask, have compassion. Understand that while we are all in the same storm, we don't always know each other's story. And people who are unable to wear masks must be accommodated. That means we cannot deny them services, but we need to find alternative ways of safely providing the services that people need. And that may mean providing curbside, online services, or arranging for people who cannot wear masks to come at a time when appropriate distances can be maintained or when barriers can be in place. And for those of you who are in that position of not being able to wear a mask, you need to as well be aware that this is an important measure right now in our community, and look to alternatives to receive those services you need, whether that's going at off-peak hours, calling ahead, going online, or making arrangements to come at a time when others will not be in that space. These are the things that we all need to do to get through this part together. On the other hand, this order does provide provisions for those people who are deliberately being belligerent about wearing a mask and are putting other people's safety at risk. And it gives the power for police and bylaw officers to take action if that happens. I also wanted to talk for a minute about rapid testing, as that's come up a number of times in questions that I've received. So people are aware, we have received a number of rapid tests from the federal government, including the Abbott ID Now, and that's one that's a machine where it has a certain type of swab that you can put into the machine. We have received 131 of the machines and 27,000 tests. However, as you can tell, that would not be enough, for example, to do all of our healthcare workers in long-term care even once at this point. And we are working on how we can best deploy those machines to help us understand when outbreaks are happening, when people need to be tested rapidly in a community. In addition, these tests are, we've also received about 500,000 of the Bio Antigen Tests. Again, that's the little ticket test that where it has a colored line. Again, these tests, all of these, are still require a nasopharyngeal swab. So that means a healthcare worker has to do the swab, and if those have had one of these recently, you understand that that's not a simple thing necessarily, because it has to tickle the back of your throat for several seconds. So right now, we're limited in how we can use these. They are also only licensed for use in people who are symptomatic. So people who have symptoms, and we know that even in that case, they're not as sensitive, they're not as able to pick up the virus as the regular NAT tests that we do on an ongoing basis that go to the lab. They are rapid, though. So if somebody does have symptoms, this is something, these tests are things that we can use to rapidly assess whether it's COVID causing those symptoms or not, particularly in some of the more remote communities in the province, where if somebody is symptomatic or 2 or 3 people are symptomatic, and we need to rapidly determine whether it's COVID or influenza or something else, that's where these tests right now are best suited to support what we need to do. They can also can also help in long-term care when we have symptomatic people, and that's one of the things that we are deploying already. And we've been looking at, we've been testing them out in places like the downtown east side, where we've had cases of people being ill, and it's a challenge to find people 1 or 2 days later when a test results come back. The difficulty we've run into in using it in those situations is they don't actually perform very well in the cold. And we don't have that much cold here in BC, but when they're used in the mobile testing labs outside, they've not been proven to be reliable. So we're still working out what the best way is to use these tests. And we hope, we have some expectations, particularly around detection of outbreaks in clusters in communities and in long-term care, and we'll be continuing to move forward with that. I will also say that these are not the tests. So these rapid tests are not what is being used in the NHL or in the movie industry. They are using the same tests that we are, which is the nasopharyngeal swab. So we do have some hopes for these tests in the future. The companies that are producing them are hoping to have certified an anterior nasal swab. So that is one that we could self-administer, which would make it much more useful. Those are not yet licensed for use in Canada, although they are in other countries. So we're hopeful those will come soon, and that will make them much more useful for us in certain situations. So I just wanted to bring people up to date on where we are with those types of rapid tests. We are expecting more of the tests to arrive, both the machines and the test kits, in the coming months, and we will be looking at how to best deploy them across the province to rapidly detect outbreaks. And we are hopeful that more tests that get approved will be more useful for asymptomatic testing, at least on a periodic basis of healthcare workers and others. Finally, as we know, there's a light in our future on the horizon as we hear more and more positive news about vaccines. As we know, though, this will be a large, complex undertaking. And to be sure that we have all of the logistics and operational support that we need in place and everything that we need to have, we have been working very hard already. The BC CDC, our logistics teams have been pulling together, working with the federal government to understand the requirements, to safely get the right vaccine and to the right people as quickly as possible in the most efficient way, starting in early 2021. And to help us with that, given the complexity and the scope of the program, today we have appointed Dr. Ross Brown, who's a VP of COVID response for Vancouver Coastal Health, to be the leader, along with myself and the Deputy Minister, of our COVID-19 vaccine program here in British Columbia, to coordinate all that good work that has gone on so far and make sure that we are ready and able to deliver vaccines as soon as they're available to us, hopefully as early as January. So COVID-19 has meant that we have all had to work a bit harder to connect in a safe way with each other. And once again, we are facing that time where it is important for all of us to stay within our one bubble. We used to have the ability to have that team bubble and our social bubble and maybe a work or school bubble too. Now we need to focus on our work, on school, and our home bubble only. This is important for getting us through this next few weeks. We are stronger when we work together, And it's important that we make sure our family, friends, and neighbors know they are not alone. So reach out. Do those things that we did back in April and May to support each other. Talk to each other. Find ways to connect with your neighbors, your friends, your family. We can slow the spread of this virus by making a difference, each of the little things each of us does today. And we know we do that by being kind to each other, staying calm despite our fears and anxiety and the uncertainty of what is happening around us, and by being safe. Thank you.
Thank you very much, Dr. Henry. And I too wanted to start by recognizing and sending my condolences, those of the government, those of the Premier, to the 13 people who passed away from COVID-19 in British Columbia in the last day, 11 in the Fraser Health Authority, 2 in the Vancouver Coastal Health Authority. That's 371 people who've lost their lives as a result of COVID-19 during this pandemic. And I think it's fair to say what we have been saying, which is, and it's true of everyone who's passed away in these times, that this is a difficult time to grieve and a difficult time sometimes to understand the nature of this pandemic, the nature of this virus, and its impact, especially on the most vulnerable people in our society. And so our hearts really go out to the families, to the friends, to the caregivers of all those who have passed away. Equally, the public health emergency that is the overdose crisis in BC. The coroner, of course, reported today 162 people lost their lives due to illicit drugs in the month of October, which is, I think we'd all agree, 162 too many. And so the efforts to ensure that people have access to safer prescribed alternatives continues apace, and we've seen the extraordinary efforts that have happened since March, that those efforts continue, especially after the decisions made by both by Dr. Henry and the Minister of Mental Health and Addiction, Judy Darcy, in the month of September. And those efforts continue, but in the meantime, we are asking people to not use alone, to take the steps they need to take to the maximum possible degree to have their drugs checked to be safe in these times, because obviously, and this is in part due and significantly due to as a consequence of the COVID-19 pandemic, this is a time of extreme toxicity in the drug supply, and a time where we all have to be careful and we all have to continue to take action. I wanted to note today as well, obviously 700,816 active cases of COVID-19 in BC today, 10,270 people under public health surveillance who are self-isolating as a result of close contact with people with COVID-19, 294 people in hospital. And so again, our teams across BC are doing extraordinary work, and there's going to be a lot of numbers, or already have been, from Dr. Henry, and I'm going to provide a few more here to put that in context. I'd also like to note that the numbers provided over the last 7 days by Dr. Henry will be included. Those numbers on paper will be included in our update today, in our written report today. After, for those of you who didn't have a chance to write them all down, we'll ensure that they're added into that report. And obviously the BC CDC dashboard will be updated. I wanted to note that yesterday that about 4,989 people were attended at emergency rooms in BC. So to put that in context, the number was 6,559 on March 9th, a representative number from the pre-COVID-19 era, just to give you a sense of the use of emergency rooms these days. And all I can say, I continue to say, is that our emergency rooms in BC are there to serve you if you need an emergency room, and encourage people to go. Our hospital capacity today is 72.3% of our base and surge capacity in terms of beds, and in critical care, 56% of our base and surge capacity. Of course, our ability to serve people in the system is always dependent on the extent to which COVID-19 both affects our hospital and affects our healthcare workers. And so that's why it's so important that we all act together to flatten the curve. I wanted to also acknowledge Dr. Ross Brown. if people are interested, under Vancouver Coastal Health, there's a very nice biography of Dr. Brown, who's really an extraordinary figure. And we'll make the occasion available to members of the media in the coming days, perhaps to speak to Dr. Brown, so he's not deluged with requests today. I'd also like Dr. Henry wished to acknowledge the 16 days to end gender-based violence and note a report which includes that subject and many others about unmasking gender inequity that was produced by the BC Women's Health Foundation and Pacific Blue Cross, and encourage people who are interested, which I think is all of us, to have a look at that report and at that document. I wanted to update you on a summary of our progress in hiring people to support contact tracing in the province, contact tracers. That this week alone, we've added 222 new hires, most of those in the Fraser Health Authority. So the number of hires is up to 935 since the Premier announced the original plan to hire 500 in August. And that was updated, as you know, in the middle of September to 608. So the people involved in that have done a truly extraordinary job. In addition to that, Statistics Canada, and we're very appreciative of this, the federal government is providing, or will be providing in the coming days, contact tracing resources to the Fraser Health Authority. That's 70 FTEs that will start work shortly to support their contact tracing team. That is not included in the hiring numbers, so that takes us over 1,000 on top of those who are doing contact tracing prior to September. In addition, the Fraser First Nations Health Authority has been approved to hire 76 community health representative positions to support culturally safe contact tracing across the province. And finally, there are 399 more candidates in the interview stage and 109 candidates in the offer process. And that our plan, which was originally to hire 500 contact tracers, is now been dramatically expanded. We have hired, as we said, 935 plus these other positions that I've referred to, and it's our intention to hire over 1,200, and as I say, another 109 in the offer process and 399 in the interview stage. We've had extraordinary response, as you can imagine, and given those numbers from people who want to do this work. And I think that tells you a little bit about how people who are involved in healthcare are committed to helping people in this time of pandemic. I want to also report on the number of surgeries that have been completed in the last number of days, in the last week, as I do regularly at this time in the week. You'll note that last week I reported that 5,520 surgeries have been completed from November 9th to 15th, the week including Remembrance Day. We've, as we do, verified the data, and the total number of surgeries completed was actually 5,793. So that's more than we announced in our preliminary numbers. This past week, we were reporting we completed 6,691 surgeries, which is a number that we expect to rise when the final numbers are accounted for. I might note that this has been affected at least somewhat by the challenges at Burnaby Hospital, including a fire and an outbreak of COVID-19, and at Lions Gate Hospital. Nonetheless, these are extraordinary achievements by surgeons, by health sciences professionals, by nurses, by healthcare workers, and we are appreciative of all that extraordinary effort and commitment. I think I just say finally that obviously this is our effort together, and this is a massive effort. When we talk about the role of Dr. Brown, the most significant immunization program certainly in the history of BC, obviously because of the attention that will be placed on it, but its importance and its speed and the fact that we're dealing with new vaccines, all of that adds to its complications, and we are sparing no effort to ensure that that goes well. And Dr. Brown, I know, will do an outstanding job working with Dr. Henry, working with Steve Brown, my deputy minister. In addition to that, all this work in surgeries and the contact tracing and the supports in primary care and the fact that we're doing record numbers of immunizations against influenza and on and on and on. We are all in, and we need everyone to be all in. We need to look, each of us, at ourselves, and we need to look deep. We must force COVID-19 to loosen its grip. And that is a critical aspect to what we're doing. On Monday, Dr. Henry talked to us about the intent of the orders she put in place to help keep us healthy, to slow the spread, to save our lives. She urged us to look for ways to make the orders work and reduce transmission, not to skirt them and spread the virus. We know what she asks us to do. We've been here before. It's familiar terrain. She asks us to bend the curve, not the rules. If we have any uncertainty about our plans, and if they're allowed, if you have a question, if we're unsure if our actions or behavior fit within Dr. Henry's guidance and orders, we need to think about where we are in the BC pandemic, and we need to make this our touchstone. When in doubt, rule it out. Don't invite, don't go, don't join, don't regret, and especially don't regret for the first three. For the next few days, especially till December 7th, when in doubt, rule it out. Our path is clear. We know what to do. We know how to do it. And right now, we need to draw upon our strength and our resolve to stop the spread. Aujourd'hui, nous annonçons 738 nouveaux cas qui ont testé positifs pour COVID-19, pour un total de 29,86 cas en Colombie-Britannique. Nous sommes attristés d'annoncer 13 nouveaux décès liés au COVID-19, pour un total de 371 décès en Colombie-Britannique. Et nous offrons nos condoléances à tous ceux qui ont perdu leurs proches durant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19 en Colombie-Britannique, 294 personnes sont actuellement hospitalisées, dont 61 en soins intensifs. Thank you very much. Merci beaucoup. We're happy to take your questions.